All right. Well, hi, everyone. My name is Bridget Richardson, and I'm the Assistant Director of Ecumenical and Pastoral Initiatives with the Nesti Center for Faith and Culture at University of St. Thomas. And I'm here with Thao Costis with Search Homeless Ministries. She's the CEO. And so she's going to talk to us a little bit today about what's happening with homeless in the Houston area and how the coronavirus has been affecting that community and what Search has been doing to try to reach out to them as well. So thank you so much for joining me. I really appreciate it.
Yes, I'm glad to be here. So this will be my first interview by Zoom. So
Good.
we'll see if I pass muster.
Well, so far so good, right?
Thank you.
Yeah. So tell us a little bit about Search Homeless Ministries for people who have never heard of you.
Sure. So Search is a organization, local Houston organization that's been here since the late 80s. We've evolved from providing basic needs of food, showers, and a day shelter to really much more focused efforts today of helping people minimize the time that they are homeless, move them as quickly as possible into their own homes, apartments, and helping them really to build a much more stable, healthy life now that they are in home so that they don't experience homeless again, and that their children can have a different trajectory in their lives.
Yeah. And so with coronavirus and everything going on, how has your work intensified or maybe slowed down or kind of changed a little bit?
Yes, just like everybody else, this is such an interesting, challenging, universally, what is it? One of our clients described it as everybody's facing this issue, right? So it levels the need field in a way. And yes, our work has had to shift significantly, just as everybody else has to. And so we are, like everybody else in the last 2 weeks, working remotely. And so how do you do that as a service provider? And that has been really a challenge. I mean, we went into, okay, here are the protocols of how do we engage with our clients. Fortunately, over the last 3 years, we have really been preparing for the engagement of people who are now in housing. So the biggest team of ours, biggest service that we provide is the case management of individuals once they have moved into homes. So we have 900 individuals, households that we are working with. Wow. Who were homeless, many of them who were homeless for years. Most of these are single individuals who were on the streets, considered chronically homeless, which means that they were out there for longer than a year, and they have a disabling condition. So these are individuals who don't have resources, and our work with them is to inform them, help them build new skills and new ways of approaching the challenges that they face physically. Where do you get your health care now? How can you do that in a way that works for you, sustains you, and keeps you from getting sicker and actually is getting you better? And how do you get the financial resources to have a stable way of living? Yes, they're going to have subsidized rent payments through our partners of the Housing Authority, through HUD funding. So while you have an apartment or at least rent paid for, you still have to figure out how to manage your life. And so that's our case managers work with them. So fortunately, we've been able to do a lot of work by phone. They are calling, asking very specific, intentional questions so that we can all try to understand where they are in their health, how are they getting around, what resources do they need, so that we know how to respond appropriately or how to help them problem solve from where they are. So I think the bigger challenge is working with the folks on the street. And I think that that's the question that I think most people have, and we too are trying to figure out, how do we best do that? What is it that they need, first of all, and how do we carefully, methodically fulfill those needs? Because as we can imagine, everything in our community is paused.
Right.
And so service providers have had to shift, stop in some places, curtail, reduce, or change how they do things. And so, yes, I think, food. I think some operators have been able to do more, and then others have had to stop. So we're still at a place where we're trying to gauge where the concentration of needs are, what are those needs, what's the scope and scale, so that when we do go back out, how do we do that and meet the needs of now? Because it's not about kind of the ongoing, because the ongoing is so up in the air.
Right. And how do you assess the needs of people who are still in the streets? Do you have a team kind of going out and canvassing, or what does that look like?
Right. So not yet. So HPD, the Houston Police Department, has a homeless outreach team. The Sheriff's Department also has an outreach team. And I know Star of Hope has a small team who have been continually active. So we are trying to understand what they have been seeing. So we're asking those questions right now. Where are they seeing the shift in needs, and what is the need? But I think, so one of the first things, of course, is about hand washing, right? So we want everybody to be part of the practice of how do you stay socially distant, how do you keep yourselves clean and not, be instructed and informed about what not to do or what to do. And so our city, local government leaders, and county have really been working, of course, very closely, as the county judge and the mayor have been trying to be on top of this, right? So our city has worked with the downtown folks to put out hand washing stations, where people who are out there on the street and have no other way to do that can go have that ability. So the next big challenge then is, if they do have health needs, where can they go? Where can they go to be tested? And then where can they go to be isolated and quarantined while they are in recovery? Right. So that is being worked on right now by our, again, the local government leaders are taking charge of that. Because, our homeless service sector, we're good at being able to engage people and work with them to be in shelter or in housing. Mm-hmm. We don't have the capacity to provide health care. That's not our expertise. And I think that's where we've been wanting and needing other sectors of our healthcare system to get engaged, because naturally our clients have a lot of health needs. And so what we can do is try to work on their housing stability, but those other kind of professional medical care is something we need that health sector to be involved. And so I think they are the ones that are trying to step up and figure out how to operate that.
Yeah, and it sounds like you have partnerships already in place that kind of help facilitate that connection too, right?
Yeah, so I think the beautiful thing of our work over these last 8 years, really, as a community coming together and trying to develop a very systematic approach versus individual agency approach, is that we have learned who we are working with and what each of our capabilities and resources can be to really help the homeless individual in that homeless experience, versus just maintaining, that crisis, trying to alleviate that crisis. It's really about long-term. So our working together has really positioned us better to be able to respond to a crisis like this. I mean, we don't have the answers and all the resources either, but at least we're in the conversation and have a heads up, or a leg up, I should say, of okay, it's not about trying to understand what each other can or should be doing, but really how can we collectively fill in the gaps.
Yeah, and I'm so interested in the work that you do, like after you get people off the streets too, how, all of the people who you're working with, the 900 plus who you're trying to help stay in those homes. Is there something for them that they're yearning for? Like, do you usually have one-on-one contact when you go and visit them, and now it's only phone? Like, what's that whole dynamic been like?
Yes, I think we are all feeling this lack of connection. And, we, in working with our clients, as we worked on housing being the primary start or first start, we recognize that being part of community and building community is one of the primary goals as well. And so we already were trying to work on that before all this happened. Now we're all feeling the need for a community and connection. And so no, we hadn't really developed such a great network yet. I mean, we had this coming home initiative, which, is this faith, different congregations, different faith groups coming together, having dinner with our participants who, on a weekly basis over 6 months, everybody coming together just to be together and to recognize that we are all same kind of different as me. I love that book and that message, and how the love and just the connectedness, regardless of who you are, where you come from, was such a emotionally fulfilling opportunity, not just for our participants, but for us,
Yeah.
right? Each of the people that came to dinner every week, or even once or twice during the 6 months. I mean, you could feel it. And so I think we know that has been so helpful.
Mm-hmm.
And so we're working on, okay, how do we do that now with this social distancing? And so, yes, I think our participants, our clients are feeling some of that because, if they're living in a single room occupancy apartment, that is the case with probably 300 of our clients. They're in the effort to contain and keep people kind of, safe.
Mm-hmm.
I think there's that isolation has been amped up, because they're not being encouraged to leave their room, their little room with their little microwave and refrigerator and, a TV, hopefully, because the common spaces are not being accessed. They can't really go to it.
Mm-hmm.
And so, yes, so that sense of connectedness just by living in an apartment of 120 other people like me, now it's like I'm back in my room and I can't really leave it,
Mm-hmm.
except for really, grocery shopping or whatever the rest of us are trying to do.
Yeah, and has your team thought at all about how to, even now within this atmosphere of coronavirus, how to bring that community, but not only now but after, like you have your dinners, but then afterward maybe doing some programs that will help facilitate that community?
Yeah, so we're working on all of that now. I wish we were further ahead.
Oh, it's okay. It's still
Right.
happening, right?
Yeah, exactly. So, so it's like these Facebook groups, right? Private groups and alumni groups or different ways now, of course. Yeah, it's like, okay, so do people, first of all, have the infrastructure capability?
Mm-hmm.
Do they have the phone? Do they have the internet access? Do they have, if we can't physically be together, how do we do that? And maybe it's as much as pen pals. I don't know.
Yeah.
Yeah, we have to regress it, but it's okay. hey, some of the things that they did back in World War II, I'm hearing about it again, right?
Yeah. And especially people right now kind of sitting at homes and some are bored, some are doing self-reflection, but I think everybody wants to help one another. What, if anything, could people do to help search homeless ministries or help your efforts?
I like the idea of like a little posting here like this.
Yeah.
I'm going to actually ask my staff to
Yeah.
do that so that we can post it out to our community too.
Mhm.
And if our clients are willing to do that, just a little 30-second, you know, today's moment, or what I'm doing or why I'm feeling this way. And just so that we can, be in tune to each other. I think that really just brings us all together or reminds us, uh, why are we here and who are we trying to help, and we're not alone, right?
Yeah. Yeah, that's great. And I know you're still working a lot, and your team, they're all working remotely at home, right? That's what you're saying before.
Yes. In fact, um, one of my one of our members on my team. So she's been at home, and I asked her, "So how are you doing? And what are what are you needing?" And she said, "I miss being in the building. I miss feeling the mission, right?" Yes. And so when you're at home and you're in your room or in this very different environment,
Right.
it's hard to keep that
Yeah.
as committed as we all are.
Yeah.
It's still disconnection.
Yeah. And what would you say to people who are struggling with that? Like people who are we use the term a lot, missionary discipleship. How would you counsel people who are very mission oriented, and right now with everything stopped, churches closed, things like that, like they can't even feed that hunger to help? How would you maybe talk with them or counsel them in this time?
Yes. Well, I mean, I think it is encouraging people to reach out to even one-on-one with another member of the team or somebody else that's in it with you, so that you can be open and vulnerable. I know we use that word a lot, and I don't want to overuse it, but that it's about being very willing to share your sense of isolation, and know that we're all feeling it
Right.
and
Yeah.
being scared, right? I mean, gosh, we get all of this dire facts and figures, and so it's like, wow, how do you react to that? How do you find other people to relate to with that?
Yeah. And in your role, people maybe have their biases about what they think about why somebody is homeless or not homeless or anything like that. But how do you see the hope of a life and a future in the role that you're in helping people get off the streets?
Oh gosh, yes, I think this the economy and all the tough news that we're hearing now only brings it to light even more about the great risk that our whole country and the world really, but I mean, if we just look at Houston and the progress that we've made, and how do we keep this at bay, knowing that it's going to get ever harder in the coming months and years. So yes. So just I'm trying to focus on the now. It's like, okay, we've got some urgent issues, challenges that we've got to try to tackle. How do we keep everybody, the community, our team, everybody focused on meeting these needs, and in the meantime also continue to build the awareness of others who may now have a different perspective about how do people become homeless. And it could be my neighbor, me, the person that used to care for me and now is not able to work.
Mhm.
So yes, it becomes much more relatable.
Right.
Mhm.
Okay, well, as we spoke about before, we started this conversation, I've been following Search's work for a long time, and so I'm very connected with your messaging, but how could other people either get on your website or join a mailing list to know what you're doing?
Yes, I would love for everybody. You know, this issue of homelessness affects us all, and it is not something that we can expect our government to be the one to answer it. You know, to come up with all the answers. We really do need to do this together because we need the community. But our clients, our people that are suffering, need to know that there are others that care about them, and by caring about them, we're caring about all of us in our entire neighborhoods, right? So yes, so go to searchhomeless.org. So search like you are searching for the answer. Searchhomeless.org, and on right on that page there are opportunities for you to sign on to our newsletter. So I've been doing a weekly, so you'll see from me and the update of what happened this past week, and other kind of resources or capabilities so that you can answer some more questions, because it's hard to answer all the questions in a letter, quick letter. But anyway, so yes, you'll hear from me, you'll hear from our team members, and see what's happening with Search. So please, everybody join in.
Okay, well, thank you so much for having this brief discussion with me to kind of give us an insider's peek of your work, and it's valiant work, especially in the Houston area. So thank you so much. I really appreciate it.
Thank you. I really appreciate you reaching out.